Well, welcome to today's episode of Health Fit TV. We are at Gravity and Oxygen Fitness with Paul Christopher. As we've been discussing, we're really diving into low back conditions in fitness and how it can be a means for you to prevent low back conditions, to make it through fitness programs if you're dealing with some sort of condition, and also what to do if you're coming off of a condition where you've had previous red flags or even surgeries, how to really manage that from a fitness perspective. And our goal today is to help answer that. But we always try to come at it from an injury prevention standpoint. Even if you do everything perfect, there are certain situations where you may lead to this low back pain. So if you can have the best resources, whether it's in orthopedics, it's in physical therapy, chiropractic, and fitness, because I always consider fitness an extension of the healthcare. If you can put that team together and have confidence that the people that you're using as resources to get you in the right direction, it's really going to help you out. And that's why I came to you today.
All right,
welcome. And I want you to introduce yourself to the audience, and we'll take it from there.
Hi guys, my name is Paul Christopher. I am founder and co-owner here of Gravity and Oxygen Fitness here in Boca Raton, Florida. To start off, my background educationally is in athletic training. So it was the triage and care of athletic injuries on the field of play. So if you're watching a football game on TV and somebody gets hurt, you see those 3 or 4 people running out to take care of that injury. That's what I was. All right. So my first experience out of school, Kevin, was working as a rehab exercise technologist over at the Palm Beach Institute of Sports Medicine here in Boca Raton. So basically, we would see rotator cuffs, low back pain, ACLs, and then we would do the exercise protocol for them. I realized that in my industry that it's a very overworked, underpaid profession, so I transferred that into fitness. But I never forgot the knowledge and the education base that I had from school and from my first experiences, and took that into a fitness realm.
Yeah, you know, it's interesting you say. I'm actually on the board of athletic training for the state of Florida.
Okay.
And I go there every year, and we're always talking about scope and things like that. I'm lucky enough to work with a lot of athletes, and I've worked hand in hand with a lot of athletic trainers. And you kind of hit it on the head, is the athletic trainer has a really, really good baseline knowledge, and unfortunately, the compensation is not there for it. But that transition from being an athletic trainer to fitness, it really lends yourself to understanding how the body's working, because you're trained a lot more than, say, just general fitness would be.
Of course, it's the physiology of an injury, and then how does that actually rehabilitate? You know, we can't speed up Mother Nature. All we can do is optimize it. So if an ankle sprain took 6 weeks to heal, we can't make it 4. Well, let's not make it 12. It's about optimizing tissue healing. Correct? So we're here talking about prevention and care of back pain, correct? An epidemic here in the States.
It's one of the worst, you know, and obviously whether you're talking about the active person or the desk worker or the combination, we have the active lifestyle person that sits for a living, or hyperactive. Like, there's a lot of different categories that all suffer from it. One of the biggest ones we see is even pregnancy causes a lot. So nobody is immune to getting low back pain.
Agreed.
It's just, that's the problem. 80% of Americans are going to suffer from some form of debilitating back pain at least once in their life. A lot of times it becomes this yo-yo effect where it happens and then it's gone, and then it happens and it's gone, because they never actually, they treated the symptoms of the low back condition, right? They never actually got to the root cause or the direct cause of it. So my question to you is, what are you finding? What are some of the key findings that you see, whether it's with your athletic training background or now your fitness, that's causing a lot of these low back conditions?
I'm going to have to say it's nurture. I mean, if you think about all babies, we weren't born with back pain, right? We learn how to go from a crawling position to standing by really teaching good squat technique. We learn naturally good squat technique, but nurture over time due to our lifestyle habits is what creates that. So, you know, your podcast is about the modern day desk jockey.
Yep. So
someone who's sitting for prolonged periods, hours upon end, is looking at a computer or working on papers, then essentially they're in a position that does not cater to a healthy spine. The healthy spine has a natural S-curve, which we have that sample right there. Okay. All right. So when we begin to tuck in and sit at desk for hours on end, then we lose that S-curve and become more of a C-curve, and it's rounded. All right. The natural curvature was built for a reason. Okay. And we accept loads in certain ways, but when we change our anatomical position, then we're taking loads the incorrect way. Now, even if you work at a desk for long hours at a day, and that nurturing process is not catering to a healthy back, you can offset that by 2 things. It's mobility and stability. Mobility is defined as active movement, and then stability is defined as the resistance against certain movements, all right? So it's about core stability, not just training your abs, okay? And then it's about healthy movement, all right? Simply getting out there and stretching and moving. And we can talk about some examples of that today. So I think it's essentially a nurturing case that our life daily habits create the issue. So that's from a point of somebody who is statically stable or sitting at a position for long hours, or somebody who is essentially overusing it. And that could be doing something too explosive with lifting or some repetitive motion like mountain biking or running. There's some compressive nature there. So it could be due to overactivity or not enough activity. You usually don't find people in the middle having that issue.
Yeah, that's what we see throughout the years is people that were either underactive or overactive, and it falls into that category of, either overuse or underuse, and it's one of the leading causes of all kinds of musculoskeletal conditions. Obviously, we're bringing it back to the lumbar spine, which is the low back, and so the one thing that he said there that I really want you to pay attention to was the mobility and the stability. Every joint in your body is going to tend to want to either have proper mobility or have proper stability. You mentioned the core, so the lumbar spine, the core, we want to have proper stability there. In the hip joint, we obviously want to have some proper mobility in there, in the joint, and in the thoracic spine, we want to have mobility as well. And it works its way all the way up and down. So what are you finding as far as the person comes in? So John comes in, he's had a history of low back pain. He's doing pretty good now, but he's always in that vulnerable state. Right? He's always like, yeah, I've had it. It's been 3 months, but like I do this, and I can feel it. What's the first thing you try to address with John that can get him on the right track of actually fixing this problem?
It's certainly mobility first. It's about movement before about loading, for sure. Okay, so I want to basically assess how they move in all three directions. The human body, guys, is three-dimensional, but a lot of times people do the mirror fit. They do the 1D training, but the body is built in 3D. So I want to see how they move from a healthy standpoint in all three planes of motion with their back. Can they flex? Can they extend healthily, properly? Can they laterally flex each way? And can they rotate? How do their hips move, right? And just from that movement, okay, I'm getting a visual profile of the things where they may be lacking. I'm a huge believer in being long and strong. So the first part is being long. That's why mobility takes place. And then the stability, the strong part, comes afterwards. So a lot of times back pain, I really believe, is due to a lack of mobility, okay? Now, if we think of that beautiful spine that Kevin has next to him, okay? He talked about joints. There are 33 vertebrae from the base of the skull down to the base of the spine and even below, okay? That's a lot of joints. They're basically like Lego pieces stacked on top of each other. So we have an alternating pattern of bone and jelly, bone and jelly, bone and jelly. Your discs are mostly made up of water, correct?
Yep.
So we have a lot of jelly and we have a lot of firm bone. And then each vertebra attached to each other like stacked Lego pieces. Now somewhere along the line, two Lego pieces don't cooperate with each other, they don't communicate, and then we have issues there. Okay? Next to the brain, I think the human spine is one of the most beautiful inventions ever made in creation. Okay? So it's a very complex structure, but it's a beautiful structure if treated the right way. So it's about teaching mobility first, okay? So like we said, 3 planes of motion, okay? So I'm gonna stand up here, and I'm gonna show you different planes of motion, okay? I'm gonna cross my arms and get my arms out of the equation, all right? I'm gonna start off with simply going ahead and wiggle my lower back side to side. Now, even though you think this motion is coming from my hips, if I turn around, you're gonna see my body moving side to side. I call this the salsa hips, all right? Stop looking at my backside. But that, in a sense, is called lumbar lateral flexion. That's a healthy move. Now, from your mid-back, your thoracic spine, where Kevin's going to point, is going to be shoulder tilts. Okay, so I'm not moving my shoulders or lifting. All I'm doing, once again, if I show you the back view, is just tilting from my mid-back side to side. Okay, so notice the first 2 motions have been sideways, but most of us are used to doing the front-to-back workout. Okay, the next one is rotation. I'm going to rotate my shoulders as far as I can go without my hips cheating, so it's not a false positive. So now we've had 2 motions of lateral flexion, and now we have rotation. The next one is pelvic tilting. Tuck in your tailbone, all right, bring in your rib cage and your pelvis closer together, and then arch your back. Posterior tilt, and anterior tilt. Think of your pelvis as a bucket going back and forth. Those simple motions, lateral flexion of the shoulders, lateral flexion of the lower back, rotations, and pelvic tilting are 4 of the most simplest movements you can show anyone. Now, Kevin, the issue is that most people have trouble even just working against gravity standing up. So if they're even having difficulty with that, I'm going to get them on the ground and get gravity out of the equation. Okay? So in yoga, we have a lot of premise in what's called the Angry Tenant camel. By moving my head, I facilitate extra motion through the rest of my back. Now you can see I'm creating that C curve on purpose to only create that S curve. All right? So I'm trying to find my healthy range of motion. Hopefully it's without pain to create mobility here. All right? Now on top of your vertebra and your disc is muscles, and we'll talk about how to create stability with those. So this is a basic, what we call Angry Tenant camel. Now we talked about rotation before, the human body being very important in rotation. I'm going to show you another movement that I'm assessing. Okay? I'm going to bring my elbow to the floor. and I'm going to extend my arm as high as I can. Now, as you can see the degree of rotation I have through my spine, that's a pretty healthy range of motion. But you'd be surprised how many people come into our facility, Kevin, that are limited or deficient in even that motion. And that right there is an assessment. So I love to say that the exercise is the assessment, and the assessment is the exercise. Yeah. So I'm watching them move, and I'm already gaining information and showing where they're lacking, and I'm going to make them, through repetition, still perform those movements as long as they're pain-free. We live in the realm of gravity and oxygen of the can-dos. So if somebody's coming in with pre-existing pain, I want to find as many things that you can do, as opposed to worrying about the can'ts and just assuming. All right? If something causes you discomfort, you know what? We won't go back to it, but let's go through my other library of tricks and figure out what you can do. And then by doing more of those cans, the other can'ts, now you might be able to do them possibly just through sheer activation of those muscles.
Absolutely.
Okay?
That's great.
Exactly. So you see, I have the front to back Angry Tenant and Camel. I have the rotations of my arms both ways. I can also even get more creative and take my arm out of the equation and do some of these movements here. We can do postural exercises, arms overhead. So now I'm firing all the muscles that support my lower back, and I basically move my extremities, and now my postural muscles are constantly firing isometrically while I do an extremity movement. I call that the airplane. Most people think, oh, hit more planks and you're going to go ahead and load, but that can also be a detriment too. And the right professional will know when and when not to use planks, because it's more than just the front of your body. It's about lateral motion and rotation and extension.
Absolutely. Cool. No, one of the things that I talk about, just to piggyback off that a little bit, is going with mobility first. Is sometimes that core stability always is the sexy thing to do and work on the core stability. And if you don't have proper mobility in that mid-back or the hips and the pelvis like he was showing, you're going to chew up that low back all day long. And you can do core stability until you're blue in the face, but if you're not getting the proper mobility, everything you do, whether it's brushing your teeth, picking up your kid, working out, anything, your job, you're actually chewing up that low back, and you just can't win that tug-of-war battle of, okay, more stability, but then you're doing everything wrong because you're not achieving the mobility in the right areas to be able to do it.
Right.
And it gets even magnified times a ton if you're doing those same problem movements into a fitness program, right?
Absolutely.
And so it can most of the people that come into me with it, it's causing it in their daily life. Now imagine if you're trying to do more advanced fitness and exercises, what do you think's happening to your body? And so that's where I think what separates you from a lot of other fitness facilities and trainers is that you are using their movement as an assessment. You're assessing them to see what their movements are. If you see them doing exercise, you're seeing if they're having these problems, and then you're making the appropriate changes, right? So
absolutely.
That's what I like to hear as a healthcare provider, because again, going back to it, I think you're an extension of the healthcare, and you need to be able to have those conversations. And I wanted to dispel one myth that is out there, is that if you are suffering from some sort of injury, musculoskeletal wise, it does not mean you can't exercise. Right. I mean, it's just unfortunate. Like a lot of my patients will go to other doctors and they say, take 8 weeks off, rest it. It's like the worst prescription you can give someone is to rest it and not actually figure out what's going on and not work around it. So I like when you said earlier about staying away from maybe some painful spots. So if someone has a shoulder issue, you can still work out, but you're just going to stay away from maybe overhead presses. Or if someone's dealing with low back injury, you're going to communicate with that provider and build something around them to work on their dysfunctions that are non-painful. Right. Correct? So kind of elaborate on that a little bit, because I really wanted them to understand that, because you said it, and I really wanted to magnify that.
Great. I think you came in maybe a year ago and you talked about that pain is a signal. All right, so pain is a signal of something going on, so some kind of dysfunction. It doesn't mean it's a cut, black and white story. Oh, you know what, you have pain with this? Hey, have a nice day. This is probably not the facility for you. Not at all. There's tons of gray in the black and white. Let's live in the realm of everything you can do, okay? Touching on that with the stability. So one of the nationally recognized certifications, the NASM, talks about the paradigm of fitness, and it's a triangle. And on the base of the triangle, okay, there's 3 different divisions in that triangle, is stability. Okay? We cannot build strength upon a low base of stability. So if you excuse me, I'm going to come out of the picture for 1 second, and I'm going to bring the board over here. All right, I just thought about this now as we got to that topic.
Absolutely.
Okay? So guys, as you're zooming in, if you can take a look here, all right? So we have a triangle right here, all right? So notice this perfect pyramid. Stability is the largest base of this triangle, all right? So if you're trying to work on excessive resistance exercises, heavy loads, but it's still eliciting back pain, then you're simply working on the middle of that triangle without really developing the base. So step 2, after you've achieved greater mobility through your spine and your hips, okay, then it's working on stabilization. Okay, so we teach you exercises to work on anti-motion, anti-lateral flexion, anti-rotation. Okay, and that's how we achieve that. But you cannot have a triangle, right, like this, that looks like a tree. You can't have a small base of stabilization with big strength and big power. You have to earn the right to do steps 2 and 3. So once we've achieved some confident mobility where either your pain is decreased or you're feeling a greater range of motion, do we then work on increasing your strength and resistive capacity, or simply just having you master your own body weight? Okay,
that's perfect.
Absolutely.
I kind of liken that to building a house on quicksand. You know,
right?
And I think that happens a lot where, unfortunately, we want to get to the strength and power without actually just building the foundation.
Right.
So
the popular statement in fitness is you can't shoot a cannon out of a rowboat.
Yes, I like that one. That's a good one. So
okay.
Perfect. So understand that you have to take the steps. You need someone to understand what you've got going on. You need to understand the different assessments that can be there to help that condition you may be having. What are some of the main low back conditions you're seeing as you've been doing this from your athletic training background all the way through fitness career?
Herniations and stenosis. Gotcha. Now, these are both things that we cannot see with the naked eye. That's why we have healthcare professionals that have the X-ray toys, right? They have the X-rays and MRIs. Right. We can merely guesstimate, but we are not the ones to diagnose unless we get the diagnostics to prove what's going on. Yeah. So generally herniations and stenosis. And it's to describe stenosis, I'm not sure if you can explain here.
I can do it.
Okay. All right. So
got the spine.
Exactly. All right. So stenosis. So we see these little tentacles coming out, these little spaghetti yellow pieces. That's actually the root of a nerve coming off the spinal cord. Now, if you notice, each little piece of spaghetti comes out of a hole, right? And a hole has a certain size to it. Discs themselves that are made up of water each have their own height. Now, as we begin to lose hydration in our discs, the actual size of the hole from the vertebra above and below begins to shrink and narrow. And stenosis means the narrowing of any hole. So if we have a hole getting smaller, then the tunnel in which that spaghetti piece comes out begins to clamp on that nerve. And whatever area of your body that nerve innervates for sensation and for motion will begin to feel numbness, tingling, or lack of use. All right, so that's considered stenosis. Now, if you guys can see, you have this little red plastic piece, right? And that's considered your classic herniation, all right? That's where the compression from the disc above, the disc below, begins to squeeze, that jelly wants to basically come out. So if I squeezed one end of a water balloon, well, guess what? That water that I'm squeezing has to go somewhere else in that balloon, and that's essentially what's going on with the herniation. Now, if you notice, a herniation can be so severe that once again, it's touching one of those pieces of yellow spaghetti. So anytime that nerve root, that spaghetti piece, is getting either clamped down by a smaller hole or getting pushed on by a herniated disc, then we begin to feel that sensation peripherally. And peripheralization of pain is usually a red flag for something severe. When it's pain just in your lower back, we can still grasp that without any surgical means. We can teach you mobility and core stability, hopefully to the point of never getting to the point of peripheralization. So when you feel things down your thighs and down your feet and down your legs, that's usually a red flag that things are more of at a severe level. Okay, so we never want to get to that point. All right, does that make sense?
Perfect, that's good. You know, like full disclosure, I actually dealt with it from golf about 8 months ago, and I just rehabbed it, did a lot of the correctives that you're talking about, worked on some of my dysfunctions, and got rid of it without any type of, injections or surgical intervention. So if you do end up falling into that category, you can do it from a physical, fitness and treatment standpoint. So keep that in mind. So, all right, that was great. That was perfect. Is there anything else you want to tell our audience that may be dealing with this? And
for sure.
We'll go from there.
Let's show a couple more movements. I think people get excited when they see movement on the live camera.
Absolutely.
All right, so I showed you guys some basic spinal movements, but remember, the human body is connected by more than just what's local. I had a mentor tell me a long time ago that if you give your baby daughter a hammer, everything looks like a nail, right? So people think, oh, I have low back pain, it must be coming from just my lower back. Yeah. But like we talked about with the modern desk jockey, we're always sitting in shortened positions. So the flexors of the hip stay in a shortened, tight sense for hours on end if you're that person working in corporate culture, okay? So how do we release that? The old school thought was, oh, I'm going to stretch my quads by taking my hand, pulling my foot, and pulling my foot and my knee back there. But not only is that traumatic to your actual kneecap, but you're not truly getting the majority of the hip flexor. You're basically just stretching out the majority of your quads. Okay? Now we have two prime hip flexors, your psoas, PSOAS, and then your rectus femoris. Okay? So if you notice right now, all right, I'm going to put myself my position in a half kneel. Okay? One knee is in the ground, one foot is forward. If you notice, I'm already starting with my hip beyond my knee. So I already have some general tension on my hip flexor. And just by simply doing a gentle lunge forward, I'm elongating that tight hip flexor, okay? We're not trying to rip muscle, Kevin. We just want to feel a little increased tension. Now, we talked about the human body moves in 3 directions. And if we can move in 3 directions, we should mobilize in 3 directions in 3 planes. And those 3 planes are front to back, side to side, and rotate. Let me show you that right now, okay? So I'm simply showing you a gentle lunge forward. What I'm doing is I'm contracting my hip extender, my glute cheek, gently to stretch out my hip flexor. So this is a simple movement. I'm taking my ankle and my knee out of the equation and isolating only the hip, okay? Now the next plane of motion, I'm going to stay forward in that gentle stretch. I bring my hands up in the air, and now I'm shifting my hips side to side. Now even though it looks like I'm moving my shoulders, I'm not, because the human body essentially moves from the earth up. So I'm working from the joint below to affect the joint above. So I'm not moving my shoulders, I'm moving my hips, and the result is my shoulders move side to side. So now my hip flexor is beginning to feel a side to side mobility stretch. And then what I can do is I can now rotate my torso, my sternum, and my pelvis, and I'm turning side to side, letting my hip flexors experience a rotational move, all right? So this is a beautiful move. You'd be surprised how many people feel relief from doing this motion right here. It's not as comfortable at first because a tight muscle does not like to be elongated, Kevin, correct? Yeah. So over time you will improve. Once you've done your 3 planes of motion, you simply switch knees, okay? We go with a gentle lunge and pulse forward, okay? We go side to side once again, and then we can rotate, right? Now, if we wanted to begin teaching core stability, it's about activating our transverse abdominis. So I can do that by doing the pelvic tilts from a half kneel. So if somebody who's having trouble doing pelvic tilt standing, let me get the ankle and knee out of the way. I'm in a half kneel. I'm going to raise up here. You're going to see my pelvis, and I'm going to tuck in my tailbone, and then I'm going to release naturally. And I'm going to tuck in my tailbone and release naturally. So the bone here in my hip and then my rib cage are essentially coming closer together, and that is activating one of my 4 core stabilizers. We have 4 main ones, and each of them are involved in certain type of stability. Number 1 is your diaphragm, which is breathing. So even if you work on breathing, you can help your core, all right? It's basically a parachute, domed muscle under your rib cage, all right? So work on breathing patterns, work on simple movements like that. We have fun toys here in Gravity in Action where we try to achieve stability. So I'm going to make this blade move, and the violence in this blade I have to try and control. So I'm going to start off in that basic sagittal plane of motion, all right? So if you notice, I have my shoulders moving the blade up and down. Now, as the wings fly, my body is rocking and shaking. And what's happening is a natural tensation of my torso. And that is a very simple core stability exercise. Now, 90% of the people can do this one pretty simply. But as soon as I expose your body to a different plane of motion, it's a whole different ball of wax. Okay, so if 9 out of 10 people can do the blade up and down, when I expose people to a different direction, maybe 2 out of 10 have championed that. And that is a classic sign as I'm having them exercise, I'm assessing them that they're not used to experiencing exercise in different directions. And if the body is 3D, I'm now exposing them to 3D planes of motion. These are the kind of things that we would do. We do tons of band training. I'm going to do something here with you as well. Okay, let's come right here. Yep. Okay, so I want you to go ahead and put your left foot forward. Okay. All right, come off the heel of the back foot. I want you to lower your hips down. Okay, so you're going to go ahead and put your left hand at your waistline, put your right hand up like you're under arrest. There you go, good, or you're under oath, okay? So now, I'm going to go ahead and have Kevin move back and forth with his right hand. He's going to press, good, but I want you to resist rotation. So give me just a hand push, and then go back and forth. So his body wants to rotate, but as he tenses up his torso, I'm creating anti-rotation there, okay? And this would be a simple body weight exercise, okay, back and forth with his healthcare professional, moving back and forth, okay? So I can feel by manual resistance and gauge his ability and his performance by doing this, all right? The actual customer and the client appreciate things like that because I'm now actually getting on the pulse of what they can do by me touching them in a professional manner, as opposed to just giving them an exercise piece of equipment, counting repetitions and saying, have a great job, Mr. Johnson, right? I'm actually in the pulse of what you can and cannot do. So professional manual resistance, simple toys like this, and watching someone move, I can assess them quickly as what they can and cannot do. And through repetition, things that were cans hopefully become cans and you're pain-free.
That sounds good.
Absolutely.
Thank you so much. I think that really covers a lot of it. And there's obviously, you could have a 4-hour workshop on this.
We can go all day with this thing.
And so I think you got an understanding of what's causing it, what you can do about it. And a couple of key take-homes for today is if you are injured, doesn't mean you can't work out. If you've had past injury, you really want to go to someone that understands that and implements proper strategies to deal with that. And then also hip flexors and also T-spine and hip mobility. Really start working on the mobility first and you'll end up a lot better for it. So.
Absolutely. And once again, as Kevin preached, talking about being part of a healthcare team. So if you're with an orthopedic surgeon, or you're with your chiropractor, or with your physical therapist, think of it as your fitness professional as an extension of that. And through good communication as a team, we can really get down to what the bare bones are of your situation and hopefully come out with a better result.
Perfect.
Absolutely. Thanks, Kevin.